My name is Stephanie Simmons. Today I'm going to talk about the benefits of getting Medicare for the elderly and to hopefully persuade them when they turn 65 or when they are preparing to retire. Medicare is the federal health insurance program for people who are 65 and older, certain younger people with disabilities, and people with end-stage renal disease. I will discuss the process and steps to make it easier for you to understand. If you need to enroll in Medicare at age 65, or if you decide to continue and have health insurance through your job, you may also do that. A big factor in determining that will depend on how large your employer is. If you have health insurance from an employer and you continue to work after you turn 65 and you're not ready to retire, you can delay enrolling in Medicare until your employment ends or your health insurance coverage stops. It is very beneficial for an elderly person to sign up for Medicare. One reason being the benefits are provided in 4 parts: Part A, Part B, Part C, and Part D. Part A is your hospital insurance. It covers the inpatient hospital care, your skilled nursing facility, your hospice, lab tests, surgery, and home health care. Part B covers doctor and other healthcare providers' services and outpatient care. It also covers the durable medical equipment, the home health care, and some preventative services. You have Part C, which is your supplemental insurance. Your Part D is your prescription drug coverage to everyone with Medicare. Family members can be rest assured by their loved one having Medicare that they will be taken care of when they need health care services. The cost of these services are worrisome to family members as children have aging parents, and it's one less thing to worry about when your loved one is sick. After you have decided to enroll in Medicare, the next step is to learn about the different parts of Medicare. As I have stated earlier, the different parts of Medicare help cover specific services. Remember, your Medicare Part A is going to cover your skilled nursing services, your hospital stay, and your hospice and some home health care. The Part B, remember, that covers your doctor services, your outpatient care, your medical supplies, and your preventative services. Step 2, you need to find out which type of Medicare that you want. There are only certain times that you can enroll in Medicare. The initial enrollment period usually begins 3 months before the month you turn 65. Includes the month you turn 65 and then ends 3 months after you turn 65. If you do not enroll when you're first eligible, you may have to pay a Part B late enrollment fee, and you may have a gap in coverage if you decide you want Part B later. Step 3, you will need to decide if you want Part A and Part B. Most people enroll in Part A when they turn 65, even if they have health insurance from an employer. This is because people have paid Medicare taxes while they've worked, so they don't pay a monthly premium for Part A. But if you do have to pay a monthly premium for Part A, the amount is $134. Step 4, you would need to choose your coverage. If you decide you want Part A and Part B, you need to choose which plan you want. You can either have an HMO or a PPO plan. You can also choose to get that Part C coverage, remember, which is your Medicare supplemental insurance. Step 5, you sign up for your Medicare plan unless you get it automatically. Some people do get Medicare automatically. If you are automatically enrolled, you will get it's a card. It's red, white, and blue is what it looks like. It comes in 3 months before you turn 65. Or if you're on disability, it's the 25th month of disability. If you don't get Medicare automatically, remember you do need to apply online at medicare.gov. After you have enrolled and signed up for Medicare, you can also visit medicare.gov for more detailed information. I love this website because it offers so much information and it's easily to understand. There's an FAQ section. It has tons of questions. There's also a section to manage your health. You will log on to mymedicare.gov and access your personalized Medicare information. This is a free service that's offered. That is awesome. At medicare.gov, you can also access Medicare forms for different situations. For example, filing an appeal or filing a claim. An advanced health care directive is also available, known as a living will, which is a legal document in which a person states which actions should be taken for their health if they're no longer able to make those decisions on their own, which is also beneficial for your family members. There's also information about electronic prescribing and electronic health records and how to access your own electronic health records, which is an up-and-coming new thing available. Remember that Medicare works with healthcare providers to be sure that the resource and information you need to coordinate your care. With insurance and medical and drug costs, they're rising at a very fast rate, especially in the past decade. And this is one of the reasons that is very beneficial to having this type of insurance. It was introduced for the elderly because the elderly population is rising. The baby boomers are getting older, and it is difficult to take care of their individual expenses. And they are also more prone to diseases and injuries. Therefore, they need to have a plan that ensures that they get the type of medical care they need. These benefits and care will also help make sure you get the right hospital service at the right time in the right setting. I hope this information, I know it has been a lot, has been very useful in deciding whether or not you will decide to enroll in Medicare coverage. Remember, you can always go to medicare.gov to get more information. Thank you.